Sorry everyone, I got cut off on my last video. So where we left off was treatment for autonomic dysreflexia. The treatment is going to be to remove that noxious stimuli. That's the first thing you want to start looking for. So in this case with my guy who was spilling hot oiled Chinese food on his legs and couldn't feel it because he is a paraplegic, would be to remove the stimuli. So get the grease off of his legs, get the grease that's on his legs off, right? And then you want to place the patient in a Fowler position. And what that position is a like sitting up, kind of like a crisscross applesauce position. You want to monitor the vitals. So I'm immediately starting to take blood pressure and monitoring that, and then get medical assistance, especially if you cannot find the stimuli causing it. Because sometimes with spinal cord injuries, especially if they have a catheter, it could be a catheter kink causing a backup pressure buildup in the bladder. So it could be something like that a doctor or a nurse may have to come in and reinsert a catheter. So definitely get medical assistance. Next, DVT. I'm sure we've heard a lot about DVT in pathology. But this is an unexplained onset of pain, redness and swelling and tenderness and warmth in an extremity. Most commonly in the calf, but I have known patients to get it in their upper arm. You definitely want to seek medical attention and hold therapy because the exercise can dislodge a DVT and cause a PE if left untreated. Signs and symptoms of a pulmonary embolism is unexplained shortness of breath, pain with deep breathing, coughing up blood, and this is definitely a medical emergency and can result in death. Heart attack. Signs and symptoms of a heart attack is unexplained pain in the chest. This could also be in the jaw, neck, shoulder, arm, or back. They could be lightheaded, nauseous, vomiting, and have shortness of breath. And this is a medical emergency and you want to begin CPR and get the AED if available. So here's a quiz. I want you to pause it right here and see if you can answer these questions. So first question, which phase of gait comes after loading response? This would be mid-stance. Which gait pattern is used for patients with non-weight-bearing status? Hopefully we all know this by now, and this is a 3-point gait pattern. Okay, pause here, see if you can answer these questions. First, which leg should you lead when ascending the stairs to improve ease? So hopefully here we all got B, the uninvolved. Remember, up with the good and down with the bad. A patient has an involved right lower extremity. Which hand should they use their cane with? So they have an involved right lower extremity. So hopefully you said the left, because remember, you should be on the opposite of the injured side. Pause here, see if you can answer this one. Which devices can be used for a 2-point gait pattern? Select all that apply. So hopefully you said 2 auxiliary crutches and 2 forearm crutches. Remember, a 2-point gait pattern here means that they're going to have 2 bilateral devices. 1 in each hand. Okay, well that's the end of all the new stuff. And I wanted to give you a quick overview for exam 2. Exam 2's not until after we come back from spring break. Look at your schedule for exact dates on this. But this is what we'll be covering. It'll be covering medical equipment and use of precautions, assisted devices for gait, gait patterns with assisted devices including stairs, weight-bearing statuses, wheelchair fitting and assessment and education, medical emergency conditions, signs and symptoms, and treatments of those conditions, what I went over today, vital signs and the response to exercise, normal gait, remember to review your traditional terminology and your Ranchos Los Amigos terminology, and the pain scales. So I hope all of you have a fantastic spring break. I will be posting the full PowerPoint for Module 2 along with the homework answers so you can start your studying process. Please email me if you have any questions about Exam 2 or practical. And have a great spring break, everybody.